Hello, everyone. Welcome to our very first episode. We are very excited to have you here with us. Thank you very much for joining us. I'm your host. My name is Rafael Ozul. I'm the founder and CEO of Ozul Group, and I want to welcome you to the Ozul Group podcast. For those of you who don't know us, we are located at 4907 South Jackson Road here in Edinburgh, Texas. We are a life, health, property, and casualty insurance agency servicing the state of Texas. Our main focus for these podcasts is to provide a direct line of communication for anyone in the state who may be struggling to understand or maybe get the help that they need with their insurance options. Whether you are in Houston, Dallas, Austin, San Antonio, West Texas, Laredo, or here in the beautiful Rio Grande Valley. And today we will be discussing the One Big Beautiful Bill, an extensive bill that was signed into law on July 4th, 2025. And there is a lot of questions. What are the new enrollment dates? What are the increase on the premiums? Do I even qualify for the subsidies? Can I afford it? And who is going to be affected? So I would like to start by asking you, the person watching this podcast, what would you do if your health insurance monthly premium increased significantly next year? Or if you were one of the millions of Texans at risk of losing coverage? Did you know that 1 in 5 adults, also 1 in 8 children here in Texas are uninsured? Please stay with us to learn how the One Big Beautiful Bill could potentially reshape the healthcare landscape and which counties might be affected the most. Please hit the like and subscribe button so you don't miss out on any of our deep dives on topics that hit close to home. Let's begin.
Disclaimer. This podcast, hosted by Rafael Ozul, a licensed insurance agent and CEO of Ozul Group LLC in Texas, provides general educational information on topics like the One Big Beautiful Bill Act and Texas healthcare coverage. It is not legal, financial, medical, or insurance advice. Laws and regulations may change, so consult official sources like tdi.texas.gov or medicare.gov, 1-800-MEDICARE, for current details. This is not an offer to sell insurance or a guarantee of coverage. Consultations booked at ozulgroup.com are informational only. Coverage depends on your circumstances, policy terms, and carrier approval. We may earn commissions but aim to provide unbiased information. Listening does not create an agent-client relationship. For Medicare plans, we do not offer every plan in your area. Contact medicare.gov or 1-800-MEDICARE for all options. For personalized advice, consult a qualified professional. Information is based on public sources as of July 2025. Actual impacts may vary. Sources are listed in the YouTube video description. Book a free consultation at ozulgroup.com to discuss your healthcare options.
Welcome back. According to summaries, the OBBBA includes provisions that cut federal Medicaid funding by an estimated $793 billion to $1 trillion over a decade. It also introduces work requirements for certain Medicaid recipients and reduces subsidies under the Affordable Care Act, which could potentially leave millions of Texans at risk of losing or maybe not being able to afford coverage. It also changes the enrollment periods for ACA to now December 15. And not only that, no more automatic enrollments. And that is why we need to get information. Estimates suggest premium increases of up to 20% or more in some cases. For some families, particularly in South Texas, could have major consequences. So my team and I got to work researching this, and one of the questions that kept coming up was, what if you're a single parent and you find out that you have potentially lost Medicaid coverage or that ACA options are no longer affordable? Could you and your kids be at risk? Of course, we know many single parents. There are sisters, our neighbors, our friends, our relatives. And what about our parents? What about the people with pre-existing conditions? How many people do we know who are dealing with diabetes, heart problems, or high blood pressure, that if left untreated, this could potentially lead to hospitalizations costing thousands of dollars? And we all seen how high those medical bills can be. At Ozul Group, we are kind and hardworking consultants who are ready to help discuss what matters most: your life, your health, your family, and their future. So I would like to start with this first slide that I'm going to be sharing on the screen just now. This slide contains information from the Texas Health and Human Services website. As you can see here, it relates to the number of people who are currently enrolled in Medicaid services. We wanted to create a list of the biggest counties in Texas. As you can see here, we also have the most recent data, again, from the Texas Health and Human Services website that indicates most current information as to February 2025. So I'm going to get my pointer here to show you. Oh, more. Okay, here we go. Texas Medicaid and CHIP full benefit caseload by risk group by county as of February 2025. I'm only going to give you guys the totals because I think that's the most important question here. Harris County has a total of 733,568 people on Medicaid and CHIP. Dallas County, 375,054. Bexar County, San Antonio area, 308,162. Tarrant County, Fort Worth has 266,996. Hidalgo County here in South Texas, we have 225,530. El Paso, we have 148,058. Travis County and in Austin, Texas, 108,040. Cameron County here in South Texas, 102,556. Fort Bend, the Sugar Land area, 81,958. Montgomery, the Conroe area, we have 73,144. Webb County, 68,216. Stark County in South Texas, 20,157. That makes a total of 2,511,440. And also, I want to show you this caseload by monthly. We have here January 4,078,565, February 4,075,503, March 4,114,630, and April 4,128,711. 711. Let me stop sharing my screen over here. These numbers are high. Obviously, it's important for us to know how many people are right now on these services. We're using these services. I would like to point out that all of the information that we are citing is going to be listed on the description of the video. And you can also go to the Texas Health and Human Services website to verify how many people are enrolled on Medicaid coverage in your county. And while we show a lot of residents enrolled in public health services, we also have a high number of uninsured Texas residents in comparison to the national average. So I would like to show you this chart. One second. This information, as you can see here, it's a trend. The trend that shows a decline over time, but Texas still remains the state with the highest uninsured rate nationally. We have information from 2013 to 2023. As you can see, Texas uninsured rate was a 2020 for 2013 was at 22.1. The national uninsured rate was at 14.5. 2019, 18.4. National uninsured rate was at 9.2. 2021, 18%. National uninsured rate was at 8.6. 2022, 16.6. National uninsured rate, 8.4. And the latest information we have is for 2023, 16.4 of uninsured Texans, while the national uninsured rate was at 8.0. The number of uninsured Texans in comparison to national average is what we just saw. And while the ACA has helped close this gap, we still have many people who might be at risk due to pre-existing conditions. And while all the counties in Texas are important, we want to focus on 3 counties here in South Texas: Stark County, Hidalgo County, and Cameron County. I'm going to bring up some information that we gathered from the County Health Rankings and Roadmaps website, also the Texas Health and Human Services. The data that we were able to find includes information on hospitalizations due to pre-existing conditions, as well as the health conditions of these 3 counties. All right, the county health rankings and roadmaps is showing us that Hidalgo County community conditions for 2025. As you can see here, this side on the right, it says these are the healthiest counties in the U.S. The side on the right is the least healthy in the U.S. The national average would be here, while the state average would be here. Hidalgo County is faring worse than the average county in Texas for community conditions and worse than the average county in the nation. We also have Stark County, Cameron County first, also low on the chart, and Stark County all the way down on the purple. It says Stark County is faring worse than the average county in Texas for community conditions and worse than the average county in the nation. Also, hospitalizations is 3 counties for diabetes and kidney disease. The information that we are showing is of inpatient hospital discharges per 100,000 resident Texans with diabetes or kidney disease. Diabetes, 12.7 of Texans adults have had diabetes in 2023. And kidney disease, 3.5 of Texas adults have had kidney disease in 2023. This is the hospitalization rate by year 2017 to 2022. Again, the inpatient hospital discharges per 100,000 resident Texans with diabetes as a principal diagnosis. That will be the blue charts, and the orange chart will be the kidney disease as the principal diagnosis. Numbers, as you can see, for Hidalgo County are really high. Also for Cameron County, really high numbers on both sides. Stark County, really high numbers on both sides. Heart disease and stroke, again, of inpatient hospital discharges per 100,000 resident Texans with heart disease or stroke as a principal diagnosis. 5.4 of Texans adults have had heart attacks in 2023, and 3.3 of Texans adults have had strokes in 2023. This is from 2017 to 2022, inpatient hospital discharges per 100,000 residents. Here we see the numbers for heart disease, and here we see the numbers for stroke as a principal diagnosis. The numbers, again, high numbers in South Texas. Here also, Cameron County, really high numbers on both sides, and Stark County also really high. At Ozul Group, we believe health isn't just about avoiding a disease, it's about thriving physically, mentally, and socially. Population health and well-being is something we create as a society. It's not something an individual can attain in a clinic or be responsible for it alone. Health is more than being free from a disease and pain. Health is the ability to thrive. Well-being covers both quality of life and the ability of people and communities to contribute to the world. Population health involves optimal physical, mental, spiritual, and social well-being. And while social and economic factors already lag in some areas, losing basic services like SNAP could mean families can't afford healthy food, potentially driving up chronic diseases and hospitalizations. And that is the reason why we reached out to Senator Juan Chuy Hinojosa, representing District 20 in the Senate. His legislative assistant, Mr. Jorge Castillo, welcomed us into his office to discuss this topic. We also emailed some questions to him to get answers to our questions about the implication of this new law, as we aim to inform you from the most reliable sources available. I would like to thank you for watching our podcast and encourage you to send us your questions as well and concerns, maybe share your story, to the OG podcast at ozulgroup.com, and to visit us at ozulgroup.com, where you can see all of the information on services we offer, as well to schedule an appointment to discuss your individual needs. Please share and like our videos, and don't forget to subscribe. We'll see you on our next episode. Have a blessed day.